Tiffany. I'll be doing the medication administration. I have Jordan filming and Allison checking on what I do. So I'm outside the patient's room. I have the provider's orders to administer some medication for Miss Jamie Wheeler. My first check with the MAR system, she'll be taking erythromycin, 250 milligrams by mouth 4 times daily. I'll be giving a varicella vaccine, 0.5 milligrams subcutaneously, so I'll give her that in the abdomen, and dexamethasone, 4 milligrams intramuscularly, so I'll give that ventricularly. And I don't have to check with any RN because none of them are heparin or insulin. And the provider says she has an allergy to codeine. She also has dementia, so she's confused, so I'll keep that in mind. So I'm going to go ahead and pull out her medication for the second check with MAR. She has erythromycin, expires 2037, will be given by mouth at 8 a.m. My next round, varicella vaccine, 0.5 milliliters, expires 2030, and this will be given subcutaneously in her abdomen. I will use a 25 gauge needle and 0.5 milliliters. I will use the 1 milliliter syringe and the top needle. And for dexamethasone, I'll have 4 milligrams intramuscularly, so I'll get that in her ventrogluteal site. And it expires 2030, so we're good. And I will give it in a 3 milliliter syringe and with a 23 gauge needle. And I will grab some cleaning wipes and a medicine cup. And so that was my second check, so I'm going to gather my stuff and head into her room. Hi, Miss Wheeler. I will be your student nurse today. I'm going to provide some privacy. Can you please give me your name and your date of birth? Okay, Miss Wheeler, 10/31/1947. So I'm going to be administering some medication for you today. First, we have, I'm going to do my third check. With erythromycin, we have 250 milligrams by mouth and expires 2037. We have varicella, 0.5 milliliters, be given in our abdomen, and expires 2030. And we have dexamethasone, which will be given 1 milliliter in her ventrogluteal site, and it expires 2030. So for the first erythromycin, some common side effects include nausea and vomiting, so let me know if you experience any of that. Alright, I'm going to go ahead and sit you up. Provide her some water. Make sure she's swallowed it. The next medication I'll be giving you, Miss Wheeler, is the varicella vaccine. Some common side effects we usually see are just usually a sore arm at the injection site, fever, redness, and a possible rash where the shot is given, so in your abdomen. I'm going to go ahead and get that ready for you. So you've got 0.5 milliliters, which is, and usually I would clean this off, but since it's capped, I don't need to do so. Let's draw back some air. 5 milliliters. And now I will cap it. Alright, Miss Wheeler, I'm going to go ahead and wipe down your abdomen. I'll do it 2 inches away from her umbilicus. Umbilicus.
Today we're going to be administering some medications. First we have digoxin, which you're going to take orally.
I would then hold for 10 seconds, but not today. The next medication I'll be giving is the dexamethasone, and some common side effects of that include depression, euphoria, hypertension, anorexia, nausea, acne, wound healing, ecchymosis, hirsutism, headache, muscle wasting, and osteoporosis. So do you have any questions for me? And we can let the provider know, and yeah. So I'm gonna go ahead and get that medication ready. So we're gonna be giving 1 milliliter. I also don't have to clean this cap off because it's capped and hard to get off. Oh my goodness, okay. And we're gonna pull back some air.
Oh, it's not a second line. And if the patient's heart rate is less than 60, I should hold this medication. But Miss Wheeler, her heart rate is 79, so I am going to administer this orally. And it has to be given at 8 o'clock. Honestly, there's like not many things you can do without fail. Yeah. The reason I should check that is ready. It is going to help with so I would also make sure to verify the medication to make sure you understand not
Alright, I'm gonna leave this here, and I'm gonna get her turned over. I'll lie you back. Alright, Allison, if you could help me turn her over. Alright. Go ahead.
injection, so I am going to be using a 23-day needle.
10 seconds and let go. All done. I'll set her back up to a comfortable position. I would then remove my gloves, do some hand hygiene. I would assess for any adverse reactions, and obviously we'll keep tabs on her. I would say the time, route and dose that I gave her, and document that, and some outcomes we should see with the erythromycin. The goal is just to get rid of her infection and use it as an antibiotic, and then varicella vaccine just to prevent varicella infection, and for the dexamethasone to suppress any inflammation and the normal immune response. So yeah, I document that and with the provider.